Guys, welcome to an exciting episode of Peak vs. Anxiety. My guest today is a clinical psychologist and the founder of Empowerment Psychology, a telehealth group practice based in Arizona. He specializes in ADHD, couples therapy, and neurodivergent-friendly care. Please welcome in the one and only Bryan Gastelle. How you doing, Bryan?
Oh, I'm doing great.
So why don't you tell everybody a little bit more about yourself, bud?
I run a practice out of Arizona. Originally, it's called Empower Psychotherapy. And I started it just because I wanted to deliver care to people that, fits the care that I think people deserve. It's evidence based, so we follow the facts, and we try to vet therapists based on their ability to connect and provide the care I think people deserve.
Yeah, definitely. So I do see though neurodivergence listed in there, which I think is an interesting topic. Has that always been a passion of yours? Are you neurodivergent?
Yeah. Truth be told, I am.
Okay.
I do have ADHD, so that's my lived experience with it, and that's part of my interest with it. I think another big part is I did a rotation at Penn Adult ADHD Research Center when I was in school, and I just love working with those folks and the type of help you can give people and the assessment part of it too.
I think that's pretty cool though, man, because not a lot of people know how to better interact with people that are neurodivergent. I think people always see it as different. They're not really sure what to say. And a lot of times, from my experience, from a young gentleman I work with now, that he's like, I went up and asked him, I say, listen, how best can I help you understand something I need you to do? You know what I mean? And he was very open about it. He's like, hey, just give me a list. So for the people at home that may not understand how to operate with some people that are neurodivergent, maybe give them some little tips or something. Give them a little helpful task, something they could know to take away.
Definitely. So depends on the type of neurodivergence, but for folks with ADHD, I think it's we've got to understand that a lot of times the effort is there and the drive is there, and sometimes it's just about execution for them.
Yeah.
So, if you can structure things for folks with ADHD, that's huge. A lot of times there might be, like reminder systems they might benefit from, but aren't necessarily, familiar with themselves. So it all depends on the context. I think the other thing with ADHD is that we've got to take the personal part out of it. So sometimes, folks might be a little bit forgetful, or, it might feel like they're zoning out or something like that. And it's not always personal. So I would tell everyone to try to keep that in mind. And I think for the autism side, it's a lot of it is just it's like a sensory input thing. So if there's a lot going on, sometimes they might get a little bit overwhelmed. So I think just having a little bit of compassion there, and depends on the case.
Yeah, and they also have to understand that you guys don't understand things in the same level that people do. So when you're talking to somebody that's neurodivergent, please understand that they're not understanding everything that you're telling them usually. And sometimes, that's what people forget. It is frustrating at times because it's like you're trying to get things done, but it's more learning what the best way to approach it is. And like I said, my experience could be different than everybody else's. The gentleman I work with, I asked him directly, hey, what's the best way to work with you? And what's the best way to make sure you can succeed, the best way possible. And he said, giving him a list of things to do and
Mhm.
times it's easiest for him. And sometimes that works in that situation, which is, I think is very interesting though, because it's like, when I'm doing this show, it's like, I get to run into different types of situations like this. So I actually reached out to somebody here in the DFW area, Dr. Kristen. She does a lot of work with neurodivergence as well. So like I had a lot of questions for her about things like that as well. So it's been nice. Now I can add you to the list, Brian. Now I can reach out to you and say, hey man, listen, I got a question for you. So
Absolutely.
so
So
couples
couples
therapy,
therapy,
man,
man.
has to be interesting.
Yeah, definitely.
Look at you, you're like, yeah.
And
So let me ask you though, and on that subject, what is like the number one common thing that couples argue about?
couples often argue about miscommunication. I would say if there's like a blanket thing I could give it, it would be some sort of miscommunication where, somebody's trying to argue the logic and somebody's trying
Hmm.
to argue their emotions or some such thing like that. Most of it boils down to communication at the end of the day.
Yeah. Yeah, but why do you feel like they don't communicate well? Is it just because well, listen, okay, so if we ask people on the street, they probably say, well, because men don't listen or women don't know how to explain, you know what I mean? Or men's, you know what I mean? The whole argument will start coming up because of their gender. But really, what is the real reason, Brian?
Yeah, so it varies person to person, couple to couple, but I think you can't give a blanket statement about everybody, right?
Hmm.
But I think it's true that sometimes men are conditioned by society to be more problem focused,
Hmm.
whereas women tend to be more, conditioned to be more emotion focused. And so the coping strategy for men is like trying to solve the problem, So if somebody says, like, hey, I'm really stressed out at work, my boss is breathing down my neck, then a guy might, stereotypically, not always, but a man might say, like, oh, well, yeah, have you tried talking to him about it? Right. And whereas women, and again, broad strokes, maybe listening for, like, hey, that sucks. I'm sorry
Yeah.
that you're going through that. And so more of a validation. Now, it can definitely flip. And I don't mean to, but there is a cultural pressure.
Yeah, of course. No, you're right, because men are not supposed to talk about our feelings. The fact that you're here today and you and I are both males having a conversation about mental health, we're already winning the battle already because
Yeah.
we all know what the suicide rates are. The 80% is just an insane number for us not
Mm.
to start talking about it. And it's like what I always like to say is like, what number is it going to be? 81% before we start talking about this thing? Let's wake up and start having these conversations, make it normal
Mhm.
because, people are so afraid to talk about them, but think about it, like the social media interaction these days when people do share their stories, a lot of people aren't ready for that kind of thing, especially people that are neurodivergent or ADHD, things they don't understand. Like today I was watching a friend of mine, she was doing an interview with somebody with DID. And, like,
Mhm.
people not knowing what they're looking at are gonna think this person's crazy, because she's just
Mhm.
going all over the place, and she's referring to herself in third person under the different identities that she has. Now, I understand what that is, but other people don't. And my only feeling about it is, like, you gotta be careful when it comes to some of these because when you have these people come in, you gotta be really careful because, like, a lot of times people don't know what they're looking at, so people may not understand and interpret the way you're intending them to look at it. You know what I'm saying? Especially with DID, because that's an interesting, whole diagnosis itself.
Absolutely.
You know,
Yeah.
and sorry, Brian, I didn't mean to cut you off there, man.
Hey, no, I thought it was a good point. Like, DID is something that really, it can look very, I guess strange to the average onlooker because you don't understand the symptoms, but it is a real thing people go through. And, a lot of times it's not the intention to come off that way. It's just a reaction.
Yeah. Yeah. Listen, so Brian, let's talk about you for a bit here, man. So have you always been interested in psychology? Has it always been a big thing, or is it something you kind of just fell into?
Always been interested, honestly. I took my first psych class senior year of high school and just kind of fell in love with it and been doing it ever since, really.
Yeah, and did you do like any others like studies? Did you watch those videos where like they interview like the serial killers and things, and you're watching their mannerisms? I
Yeah.
always thought that to be the fascinating part of it all too. Is like you're watching them, and you see these people have committed these heinous acts, and like they have no emotion, and you're just like, whoa, I'm so interested
Hmm.
because, like, why do they react like that? And when you really get into it, then you start realizing, what it is that really is going on in their heads a lot of times. And to me, it was fascinating. Now,
Yeah.
how I stumbled across this podcast is that my own mental health issues I dealt with and things like that all these years. And then I went on my own self discovery, and then I realized that we're not talking about it enough. Like, I am not trained by any means. I'm just an average person that is very advocating out here that we need to talk about this stuff more. Like, you go to the doctor every day, you can talk about your cancer situation. Hell, you can talk about HIV these days, but we can't talk about our mental health. You know what I'm saying? Like,
Hmm.
it's insane. Like, why do you feel that people don't talk about it enough though? I mean,
I think it's a misnomer that we live in a society where our behavior is usually an indicator of like who we are and our
mhm,
personality, and we're just held to that standard. And so, like with psychology and variations of that, it does influence our behavior. And so, people are often like, well, that's a flaw on the person's part because they're behaving differently than they should. You
yeah,
know what I mean? Versus like if somebody has cancer, it's more just like, oh, that's not something that they wanted. It's just something that happened to them. And so I think to dispel that stigma, we really need to see mental health as, the kind of the way we see medicine,
Mhm.
anything else in medicine.
No, I agree. Listen, I want to touch on the cancer analogy. I think it's the same thing with some of these conditions that some people didn't ask to have BPD. Some people didn't ask to have PTSD, because originally we thought it was just the soldiers that had it, but then we realized it was everybody that can get PTSD though. Like these people didn't ask for these things to happen, you know what I mean? But I think you have a really good point there though. It's similar to that. Like people don't want cancer, but like when you really go into the deep diagnosis of some of these things these people deal with, it's like BPD, for example, gets mixed up with bipolar a lot of times, and people are
Mhm.
like, but it's because they're so close. But BPD is more expansive, though,
Mhm.
and things like that. But people don't know that, though, And I feel like the misinformation of the internet is the problem. That there's too many voices out there, and then people like me that are out here fighting against that are like, no, man, listen, you need to listen up. This is what you're really looking at. And I think that when it comes to those things, people are quick to label things as crazy, like, oh, they're crazy or they're narcissistic. That's my favorite one there. Okay.
Yeah.
So everybody calls everything narcissism. I don't know. You probably see these and you start laughing your
All the
ass off
time.
like, dude, this is ridiculous. Like, you have no idea what you're even talking about. It's not even close. Because, people put boundaries up and then it's, oh, you're being narcissistic or you're,
Mhm.
or you're being selfish. You know what I mean? These are all things you probably hear on a daily basis.
Yeah, there was a while there, that, on a regular basis, I would be, dialing back the narcissism diagnosis, just because of social media and just it being thrown around so much.
Yeah.
And so, yeah, I definitely know
Brian
what you mean.
Brian's on there stitching your videos. Oh, listen, Dr. Brian here. Let me tell you exactly how this works. Just start cutting in and telling him. I can just see it now. Brian's gonna appear. Hello, Bryan Gastelle here. Let me tell you what this actually is going on in this situation. Like, I'm looking for it, dude. I would die laughing. Like, oh my god, that's my boy Brian right there.
Nice.
That's hilarious, man. So, with not neurodivergence said though, I do think the same thing happens with people. They see this and then they think that these people are crazy or they're quick to judge.
Mhm.
But, I think what a lot of people need to understand is that, like they don't understand social cues either. Like, so some of them will come up to you and just like, the normal like interactions you'd have with normal people. Like I have a guy that comes in that's neurodivergent to my store. He's
Mhm.
very friendly. He likes to like pat you on the shoulder, kind of stuff like that. And to everybody else, it's really weird. To me, it doesn't really bother me because I understand his situation. Like I love him to death. My buddy
Mhm.
Gary, he's my love that kid to death, dude. Great kid. He's a big baseball guy and stuff. We'll come talk baseball and things like that too. So whenever he's in the store, I always try to interact with him every single time. And regardless of what I'm doing, I'll stop what I'm doing, literally go over there and talk to him for a minute. Cause he comes in, he's always excited to see you, and people just look at you weird because they don't understand what's going on.
Mhm.
And he's just kind of doing his thing, just being Gary, and everybody's just looking at you weird. And I'm just like, fuck y'all. I don't care, man. Like I
Yeah.
try to make them feel just like as normal as possible. You know what I'm saying? Like I don't let them treat them any differently, but I do understand on a deeper level though that that they do interact in a different way. And I know my ex was like she met Gary and wasn't really too fan of how close he got. Like Gary was a close talker type person,
Mhm.
but I was like, Gary's not just doesn't understand those things, and like I just don't let it bother me, honestly. You know what I mean? But I think
Yeah.
doing this podcast and the more things I learn about people of neurodivergency and all that stuff is it's great, man. I love it. Love the things that you're doing too. Because you're
Thank you.
making it easy for people and you're making it friendlier for them too. Because I think not a lot of people advocate for them enough.
Well, I think it's really cool what you're doing, and, I can see already that you're trying to dispel the stigma, which is what we need.
Always, always, man.
Yeah, and so, yeah, like folks with, autism, depending on, where they are in the
Hmm.
the spectrum might, most, folks who do not have autism will have this natural kind of social radar or instinct, if you will. Like, implicitly, we wouldn't stand, less more than, I don't know, a couple feet away from somebody.
Hmm.
And so that intuition isn't there. It can be taught though. But to your point, I think it's important to just treat them like a human being, um,
Yeah.
and understanding is the key. Because if you know where they're coming from, it's like, okay, you know,
Yeah, but not a lot of people do that though. I feel like we're too quick to judge people, and it's honestly to me it pisses me off a lot of times because it's like, Gary at the end of the day is a really cool guy, man. He's a baseball fan. He loves baseball. Comes in, talks to me all the time. And a lot of people always give me weird looks, and if they do, I'll say some shit. I'm like, "Yo, what? What's wrong?" "Well, what was that?" "Don't worry about it. That's my boy Gary. Don't worry about it." Like, I'll stand up for him. Like, I'll fall on the sword for Gary, man. Like, don't come in and harass my boy in my territory. When you come in my store where I work, you better be respectful to Gary. If not, it's gonna be I'll call you out because I have no problem doing it. Like, to me, it's like that's my boy. Like, I stand behind him 100%. And I always, and with my kids too, Brian, when they were
Mhm.
younger, they always stare at people with disabilities and things. I said, "Go, what I'm gonna make you do? I'm gonna make you go over there now and go talk to them and
Yeah.
ask them what they're dealing with, so you understand that that's what you're looking at. So don't stare at them. You're not the zoo. It's very rude. Like, if you want to ask questions, go
Mhm.
and ask questions. Like, I had a gentleman that came in and said he was schizophrenic. It
Mhm.
was funny because I was like, "Ooh, wait, hold on, wait a minute, schizophrenic." I heard that across the room, dude. I was like, "Ding!"
Yeah.
I'm over there. I run across the room and I said, "Sir, can I ask you a question?" I said, "Now, I'm asking you this because I run a mental health podcast and I'm very interested." Like, I led with that. I
Mhm.
said, "Can I ask you about your schizophrenia?" And he said, "Yeah." I said, "Can I ask you this? Like, I'm asking strictly pure from this fact that I'm very fascinated. Do you hallucinate?" Because you know how that stigma with that is, like, a lot of people assume people with schizophrenia automatically assume,
Mhm.
like with like a New Beautiful Mind, they think it's kind of like that, which I mean, it's a great movie, but it's not how everybody is.
Yeah.
So this gentleman, he said that, "Yes, I do a little bit. I see like little shadow images here and there."
Mhm.
And he was really cool about it. But I think it's the way I went about saying, like, "Listen, I'm clearly asking because I'm very interested in where I'm coming from." Made it a little more easier of a conversation. And mind you, I have people that come into the store and they tell me the wildest things. Like, there's a gentleman that came in and told me his son took his life, unfortunately. And he said that he just didn't understand why the fact that his son used a gun that he bought him for his birthday to do it. And I said, "Well, we may never know, man, and just don't blame yourself." And doing this podcast and meeting people like yourself, I'm learning different things, like how to address these situations a lot better. And he's like, "That's the scary thing about it." He's like, the guy said, and he said his son in the note said, "Don't, it's not your fault either." And I said, "It's really not. You couldn't control what happened in that situation, and it's hard when it comes to those subjects."
It is. It is. And that's a good point. I think it's all in the approach. If you ask somebody, a lot of times, not always, but a lot of times they'll want to share their experience or, want to share.
Did you have a lot of people growing up give you a hard time because, like, the reason I'm asking you like this is because when did you discover you had ADHD? Did you know at an early age or was it later on?
It's a good question. Yeah, I got diagnosed when I was 13, I think. And
Okay.
a lot of times up to that point, it was just a lot of folks with ADHD can probably resonate with this is that everybody has an explanation about it, is lazy or doesn't apply himself or, and it's a struggle sometimes to, have an invisible illness like that. But it really changed my life when I was diagnosed, got on medication, got the correct care, and things really turned around for me. So it
Yeah. So
was a
did you
big
have a really
deal.
good support system? Were your parents really supportive of it when they found out about what it was?
Absolutely.
That's
Yeah.
awesome.
Yeah. I was lucky there.
So did you let me ask you this though. Did you get bullied as a kid a lot?
I can't say I got bullied. I think there's a lot of like misunderstanding of the symptoms though.
Yeah.
So, people do like wave their hand in front of you or like just misunderstand the symptoms, like if I forget something, yada yada, the list goes on. But I think knowledge of it and really building like that public understanding of mental health is the key and can help change the experience moving forward for
Well,
people.
having people like you come on and share your experiences and the things you're doing now and the work you're doing with people with neurodivergency and thing, making it friendlier for them and it's helping too. So this is a hand to hand thing. Not only am I raising the topic, and having this conversation by inviting you in here to come talk about it, we're also highlighting the things you're doing. You work with people with anxiety, burnout, relationships. So I think that one's probably the fun one. Relationships had to be the fun one, honestly. Like, you're sitting there listening to them argue and you're just like,
It's never dull, very, very,
right.
very.
So, Ryan, if you could tell somebody at home something about anything, like anybody with ADHD or whatever, what would you say would be the number one thing to understand when it comes to those kind of conditions? What was something you want people to understand? Some things they should look out for, like, hey, listen, if you
Mhm.
notice these things, it's a very strong possibility this person may have that.
For ADHD, I could say there's two different types. So there's one that's the inattentive type, and then there's
Mhm.
one that's hyperactive impulsive. So inattentive, it's going to be things like forgetfulness, motivation, procrastination is a big one.
Mhm.
Now, I would recommend going in to see a professional to get that confirmed because there's some overlap there. But disorganization, trouble with details. And then on the hyperactive impulsive side is kind of the more, I think what most people understand ADHD to be. It's a more stereotypical type, where it's just like driven by a motor, impulsive, jumps into conversations, stuff like that. So, um, really, if you suspect that any of that sounds like you, I would recommend going to see a professional.
Yeah, definitely. Definitely. Well, they come see you too. Listen, there you go. If you're in Arizona, come see Brian. He's there, Go check out
Absolutely.
Empower Psychology. He's got you covered, man. Telepractice too. Listen, so did you start yours like during COVID? Because I know telepractice was really big during that
Mhm.
time because people couldn't leave their houses and things like that. I'm sure you had an influx of people coming through, yeah?
Yeah, COVID was kind of a game changer. Really, telehealth wasn't on the map right up until then, and then COVID just changed everything. I started my practice a little bit after the height of it.
Mhm.
2021 was the launch of it,
Mhm.
and like late 2021, and yeah, the rest is history.
Well, I mean, it makes sense though, man, because I prefer anything I can do televisit. Like I'm like, I don't have a problem going to the office setting. It's just more comfortable for me. I'm here in my house. I can do it. That's how I do my therapy sessions now. I have a 6-time international bestseller as my therapist. I met her on the show, which is funny because I like to tell people that. But I like the telehealth thing. Like I like that I could just sit there and call her and talk to her and not have
Mhm,
to be in an office setting. I stay where I'm comfortable. And I think that when you started this company, you took advantage of that though to the
mhm,
point of though that you're fitting into that need for people that don't want to leave their houses. That's why a lot of them don't do therapy. Well, I don't want to go in an office setting. I think you
mm,
capitalize is what I meant to say. Not take advantage, but you capitalize on the fact that you knew that people were really big about this kind of thing, which I think is great because it's
mm.
the comfortability of being in your own space is better because especially I'm sure a lot of people open up a lot more when they're in their comfort zone kind of thing. Wouldn't you agree?
Yeah, definitely. Going to therapy is a big leap sometimes. And so, another goal I had with the company is to make that a little bit more comfortable, right? So you don't have to go into an office and so to be fair, some people like that and there's services out there for that. But I think for many people, they'd rather be in their home and, feel a little bit more grounded that way.
Yeah, no, I agree 100%. Are you only licensed in Arizona or are you guys available to be in other states yet?
We're expanding every day. Right
Sweet.
now, we've
Okay.
got New York, Florida, Idaho, Vermont, and counting.
Okay. Okay. That's really cool though, man. That's good that you're looking to expand on a broader scale. So that's really good though.
Mhm,
So what kind of services do you guys offer? Just like I know you do couples therapy. Then I mean, sorry. Let me rephrase this question.
mhm.
What kind of services do you offer for the neurodivergent? I know you neurodivergent friendly. So what kind of services do you offer them? The same kind of things you would like normal people, but it's more adapted to fit their needs?
Yeah, so I actually personally do a type of therapy called CBT for ADHD,
Mhm.
which is a variation of CBT, which is cognitive behavioral therapy. So, thoughts, behaviors, and emotions. And what we do for folks with ADHD is we look at it's a little bit more education based. So, if you know your brain, then you know how to step around the weaknesses and capitalize on the strengths. And so that's what I give to folks with ADHD. And then we've got a lot of providers that are really well versed in that. And so we just make a point to have a lot of support for a lot of different types of neurodivergence.
That's awesome though, man. I mean, that's great because you took the extra steps to make it easier for them to, made it more friendly, like you say. Like I like the wording. Sorry, I like the
Mhm,
wording you use. It's friendly for them. That way, they don't feel like it's such a burden, or they don't feel like they're alone and they don't have any care for themselves. Because I think a lot of people tend to exclude other people and don't really customize it for the different groups of people that can't understand things in the same way.
yeah, yeah, I've seen a lot of people get a lot out of it, to be honest, and
That's
so
awesome though, man.
it's
It has
always
to feel good
meaningful.
though. I mean, you see these success stories, see these guys start thriving and things like that too, Do you get a lot of cases of burnout for them?
Yeah, yeah, a lot. Burnout can happen just because, especially, well, actually, it can really happen for autism and ADHD, but it's usually like the job that they're in is pushing them to work against their strengths, right? So, folks with ADHD in a job where it's like a lot of organization and memorization and stuff like that. And that's where we come in, we'll give you tricks to work around that stuff and, make it work for you.
That's so cool, man. Do you reach out to a lot of Fortune 500 companies and offer your services like that? Like, listen, hey, let's make this a little more friendly for neurodivergent people to be in the workforce.
That's a good idea.
So, Brian, have you seen this pizza place that I can't think of where it's at though, where they hire kids that are neurodivergent thing? I saw
Mhm.
it the other day on Instagram. I thought it was a really great idea. It was really cool. This family, their child was neurodivergent, and the thing was they couldn't find a job for them that fit them best. So they opened a pizza place, and it's run mostly by kids with neurodivergence. I don't know if
Wow.
you've seen this or not. It's actually really cool. Like I'm trying to think what it is now, what it was
Hmm.
called, but it was such a really cool concept, and it was really cool because you saw the excitement on the kids' faces as they're, making orders and they're handing out the orders and things like that too. And I think that's really cool. Honestly, that's really something that
Wow.
was really really cool to see. I don't know if you've seen that or not.
Can't say I have, but that sounds incredible. I'm
You know what I'm
glad that
saying?
they're doing that.
So so listen, if you were talking to an employment setting,
Hmm.
okay, so what would you tell them would be the best methods for handling someone with neurodivergence? Like, what would you say a neurodivergent workplace would look good for them? Like something friendly
Hmm.
that's adapted for them.
Yeah, so I think it depends on type of neurodivergence and their specific needs, but
Hmm.
to give you some general, answer there, I think for the folks with ADHD, it would be like scheduling systems, reminder systems, maybe even like a dashboard or a whiteboard or something like that. Just because folks with ADHD tend to be big picture thinkers and can get overwhelmed easily. So if you've got like a bunch of reminders everywhere, then you get the best of both worlds. You get that ADHD spark, and then you also get, efficiency. And I think for folks with autism, it would be just being understanding, compassionate of the symptoms that they have. So sometimes like sensory overload is a thing. So maybe not requiring them to work on site or, soundproof office or very clear, exact guidelines.
Yeah, yeah, that makes sense. So I mean, you want to make sure it's easier for them, and I think a lot of people need to start accepting that fact too. Is just like understand. Like my boss is very understanding with the gentleman that works with us that's neurodivergent. He's autistic, so like her friend is actually has a couple kids that are autistic as well. So she got a lot of advice from her, like, hey, listen, how do I better approach him? Like this woman went to the extent was like, hey, listen. I'm hiring somebody that's on the spectrum. How do I better handle him to get him, make sure he feels like he's not being overwhelmed and stuff. And she went to the full extent and was asking her, which I thought was really cool because you don't see a lot of people going out of their way to ask these questions. And I guess she lucked out too because her friend, she had somebody to lean on that's a parent. Hey, listen, how can I approach him better? That way I get more out of him, and make him feel productive, you know what I'm saying? And things like that too. Because you want to make sure they don't feel overwhelmed. So, I do notice that sometimes with him, like if you take it little by little, he's more
Mhm.
productive versus trying to load everything on him at once, which,
Exactly.
it's a learning experience in general too when you interact with those individuals and stuff like that as well.
Mhm.
But like hats off to my boss, like I said though, man. She's been really cool about it though. Like he does really well. He has some days where it's rougher days from, but I mean that's for anybody. We all have rough days, especially with
Mhm.
burnout.
Yeah.
Like, a lot of people are experiencing that nowadays because, with the economy the way it is, a lot of people are taking on a lot more than they can handle. And then
Mhm.
they don't rest the proper amount of time or they don't take enough time for themselves and do enough self care that they start having these issues. Like, I experienced burnout really bad myself, and I was just like, you could tell. And my boss actually brought somebody in to help me out a little bit because she could tell I was having the issues too and things like that as well. So, hats off to her to notice that because that's what she was talking about the other person. The other person's like, yeah, they brought me in because they said you were burnt out. I'm like,
Mhm.
yeah, I'm tired. I'm irritated. Like you're trying to do too much and you feel like you're overworked. You're not sleeping, and then that's the thing too. You don't sleep enough, you start like your irritability goes up and like with anybody's.
Yeah, absolutely. I think that just to follow up on that, a lot of employers probably have neurodivergent staff and don't realize it. right? And so I think if you make a welcoming environment, like maybe even on the intake,
Hmm.
would you like accommodations or something like that?
Hmm.
Then now you've got people that are going to work more efficiently for you who are already going to be there anyway.
Yeah, I think that's interesting too because a lot of people I think are afraid to say they have disabilities because they feel like they're going to be
Mhm,
judged on a different scale.
mhm.
Would you not say that's true though?
Definitely. Yeah,
So,
it's very common to concern.
right, exactly, man. It's just crazy because it's like, we want them to feel like normal people, but then it's like, but then don't overdo it though. You know what I'm saying too? Don't baby them. You know what I mean? Like that kind of thing too. It's like, no, don't do that, please.
Yeah, yeah, you don't wanna lean too far into it and, change the whole thing around, but I think just having, like, little accommodations, being, in an open way, kind of accepting of it would really
Yeah,
go a long way.
definitely, man. Listen, do you have any advice for people at home for like, anxiety? Like any tips
Yeah,
you want to add to the conversation with this wonderful thing? I know anxiety is a big thing for you, so lay it
of
on them,
course.
Brian. Tell them.
Alright, so first thing is it does depend on the type of anxiety you
Hmm.
have, but I'm gonna give you some broad strokes coping skills, if you want. So
Yeah, go ahead.
One one would be paced breathing. So anxiety is like a fight or flight response where the heart rate goes up, blood pressure goes up. It's kind of like our body thinks that we're in danger. And so what you can do with physical symptoms is called paced breathing. So for those folks that are interested, what you would do is relax, find a position that's comfortable for you. Close your eyes if you're willing, and then focus as much attention as you can on the feeling of the air as it travels in and back out of your body. Ground your attention in that. Take 5 seconds on every in breath, 7 on every out breath, and do that in, let's say, 5, out 5. And then take into account how you feel afterward.
Oh, I feel amazing, dude. I love it, man. Listen, and would you say that this practice comes from like breath work, basically the same principle of it? Almost like you're resetting your system.
So the longer out breath is the thing that tells our body like calm down because when we exhale, our nervous system basically lowers itself, and so
Yeah.
that's why we want the longer exhale. So folks who might not like the 5 and 7, just everyone's got different lung capacities. Do what's comfortable for you, but make the out breath longer. Then another real quick trick for anxiety is if you've got an ice pack frozen bag of peas, sink with cold water, you can do what's called the dive reflex. So hold an ice pack between the bridge of your nose and your forehead, count to 30, see how you feel afterward.
You know what I use, Brian? Because I work in a convenience store setting, so I go in the freezer sometimes and take deep breaths. Like I combine the first one and I do that too at the same time simply.
Hmm.
And it helps because my anxiety sometimes gets really bad.
Hmm.
In my experience, sometimes, when the thoughts are racing through my head, I like
Hmm.
to say things out loud. Like I'll start like talking them things out loud to
Yeah.
myself, and people will
Yeah.
start looking at me like I'm weird. But like most of my staff now know exactly what's up. Like they know because they
Hmm.
know I run a mental health podcast and things like that too. So really, it's not really weird to them. But other people may see me doing it and go, "What the hell is this guy doing over there?" A lot of times, what I'm doing though is that I'm trying to like distort the fact that these thoughts that are going through my head like, I'm trying to debunk them. Like, if I'm thinking something completely wrong, I think somebody like, say like you and I we've been good friends for a long time, and I think Brian's jaded me in some way, and I'm like really
Hmm.
pissed off. But it's never the case. Brian never did this. My brain basically takes it and runs with it, and it'll
Hmm.
start inventing new scenarios. So I'll start talking the scenarios out, so I hear what they sound like. And
Nice.
basically, what I'm telling myself is that you listen, you're kind of being goofy. You need to stop, and essentially, I'm resetting myself in the same sense. But to everybody else, I'm having a conversation with myself, which
That's
I
a
don't
pretty
care. At this
effective
point, I
tool.
don't care because at this point, I don't care. If it helps me, I'm worried about Pete. Like, I'm worried about Pete when it comes to the end of the day. Like, I don't care how
Hmm.
crazy I look when I'm doing these things. It helps. Or I'll tell myself, stop, like real loud sometimes. I'll just shout it out really loud.
Hmm.
And
It's
a lot of
numbing.
times it's just because it's just cycling through there, and it's hard for people that don't understand that.
Yeah.
Like I'll tell you about this thing that happened. So I was at work, I had a panic attack. So for everybody that doesn't know what a panic attack is like, it's almost like you're having a heart attack almost. You can't breathe, your pulse starts racing, And, sometimes, when it used to happen, I could tell it's about to happen. Like, I'm going to have a freak out session. And I tell somebody, listen, I'm going to freak out. Don't panic. Like, I brace them for what's about to happen. I said, do not panic, whatever you do. If I look like I'm in a panic state, just don't freak out with me. Just let me be. I'll be fine, And it's
Mhm.
like, because most people will, first reaction will be like my boss was doing. One of my other bosses would come to me, well, you just need to calm down.
Yeah,
No, no, don't do it. And listen, if you're not watching the video of this, Brian's laughing at this because he agrees that he knows this is ridiculous. And the one thing you do not tell somebody is just to calm down, because it doesn't work. You're not doing them any good. You're going to upset them even more. And then the other thing she was doing, like, she would come back out and she'd be like in a frantic pace, yelling and screaming about something. And I'm like, and I'm out there freaking out. My buddy's standing there looking right at me. He's watching me. And I'm just having a complete meltdown out there, just going off, doing my own thing, just saying, like, getting the thoughts out of my head, just like the
Mhm.
deflating balloon analogy. Like, it is just the air is just, and then she's like trying to add to it. And he's just standing there. It's like, you get over there. And he's just standing there. And he's just watching me.
Mhm.
Now, to most people watching this scenario are thinking like, okay, well, this guy's just watching this dude have a freak out, but he knows what's going on and
Mhm.
he gets it and I get it. And it's great when people understand things, now, when I really haven't had any more moments like that though, but I was like, I just want people to understand, like, don't tell people to calm down. It doesn't help sometimes.
Mhm.
Like, it's better to ask them what they can do. Now, my
Mhm.
situation is I'm open and I'll tell people, hey, listen, this is what you can do for me. And I'll direct you what to do through this thing, because I don't want people to freak out. Like, anybody new I meet, I tell them the same thing. Like, if I start freaking out, I said, just let me be. I'm clearly
Mhm.
just having a moment. Just let me go. I'll be okay in a minute, and just, I'll instruct you through it. Now, most people may not do that.
Mhm.
And Brian can agree to this. Probably most of what I'm saying is right. But, if you ask them exactly how you can help them is the better thing. Am I not correct?
You got it. Yeah. That's what I'd tell anybody. If you notice someone is, clearly anxious or they're going through a panic attack, the best thing you can do is just an open ended question like, hey, how are you feeling? Calm tone of voice. And then how can I help you? If the answer is you can't, okay,
Yeah,
accept that.
just stand back and just be there in case they start like panicking or start passing out or something. Obviously,
Mhm.
watch for that kind of thing, because you don't know. People sometimes will just get to that point, and things like that too, and stuff like that. So I think it's always funny when people always tell you just to relax, or they tell you, "Oh, everything's okay." It's like you don't realize, like, I'm having a Chicken Little moment in my fucking head. Like, it's literally,
Mhm.
the sky is falling. It's literally happening to me right now. It may not
Mhm.
really be happening, but in my brain, that's what's happening right now.
Yeah. Yeah. And so, the going back to the pace breathing and the freezer thing or the ice pack is if somebody calls me and they're having a panic attack, sometimes I'll do phone coaching. Those are the two skills I'll start with, if that tells
Yeah.
you anything.
So did you want to give somebody a couple tips on that in case somebody were to call them panicking like that? Give them a little, may give them a little help, Dr. Brian. Let them know how to do this thing, man. Tell them.
So here's what you do: go to the fridge, grab a frozen bag of peas, then go sit down in a recliner, sit back, do the pace breathing like we described. Hold the ice pack to your forehead. After the first three ins and outs, take the ice pack off. Finish the other, let's say, three ins and outs. If you still feel upset, keep doing it.
They could coach them on the phone too if somebody were to call them freaking out in the same scenario, right? Just like, hey,
Hmm.
listen, I want you to try something, like tell them this is going to sound a little weird, but go ahead and try this for me. Dr. Brian told me
Yep.
this is what to do.
Yeah.
They're going to be
Yeah.
quoting you like, Brian told me to do this. So I heard this on a podcast. I got to tell you something. Here, try this. So, Brian, we're at the fun part of the interview.
Hmm.
I'm going to ask you two questions, okay? So I ask all my guests the same questions this season, okay? So the question
Hmm.
to you is, if your mental health had a song, what would that song be?
My mental health. That is a good question. You know what? I don't have a good answer, so I'll give you a different one.
Any song you think of, Brian. There's no wrong answer to this question. The first song that popped in your mind when you heard that.
So the first song that popped into my mind is, how meaningful it is that the meaning I get out of the work I do. There's a song called "Make Them Gold" by Churches.
Mm-hmm.
Highly recommend giving it a listen. It's inspiring, and it's kind of why I do what I do.
Yeah. Yeah. Do
Yeah.
you like a lot of music though? I mean, I know music's really good for people. A lot of people with mental health, a lot of issues. A lot of times they listen to music, a great soother. and things like
Mhm.
that as well. So what would be on your Brian's playlist?
Oh, I've got all kinds of stuff. But I can tell the folks who are dealing with ADHD that there is this site, it's called brain.fm,
Okay.
and they use these scientifically backed like tempos to improve your focus by about 30%, which is
Okay.
enormous.
Guys, listen, I'm going to put these in the notes. I'm not trying to cut Brian off. Real quick, guys, we will put these in the notes for you where to get to this website for sure. If you're listening at home, that way you can go check this out for sure.
Yeah. So truth be told, I listen to a lot of brain.fm, but yeah, I'm into like electronic, honestly, I'm kind of all over the map to be
So
real.
what are some of your favorite artists these days? Any songs that come to mind that you really like in nowadays?
Good question. How about
Brian,
say,
if you come with me with Backstreet Boys, Brian, I'm not going to be shocked. Okay, we'll be best
yeah, I
friends.
was in sync, Backstreet Boys,
No, you can't say NSYNC too, Brian. Come on, you can't be on both sides of this thing, man. You can't be the peacemaker in the middle.
No, I'm a big Foo Fighters guy. I think I've
Oh,
always
okay,
been into
okay,
the Foo Fighters.
all
So
right,
yeah, I feel like that's kind of like central. Grew up on that alternative
yeah.
rock thing and never really grew
Like
out of it.
Nirvana, listening to who else was down that time.
Yeah.
Green Day, Ugly Kid Joe, all that kind of stuff like that.
Yeah, absolutely.
Yeah, listen. I've had a lot of musicians on the show too, and things like that as well. Some of the people I've been listening to lately. I don't know if you like rock.
Mhm,
Let Me Bleed's a really good one lately. I really like. I know the title of the band sounds kind of crazy, but Eddie
mhm,
writes these amazing songs these days. He did a really good cover of "Bring Me to the Horizon's" 10 Statues That Bleed Blood. Really
mhm,
good acoustic cover. Like I like a lot of acoustics myself. Like Bush is really good. I like the Goo Goo Dolls. MGK
mhm,
is a big one nowadays for me. And then I'll go to like the other side. Like I like my metal when I'm angry. I like my metal. Like Slipknot. Marilyn
mhm.
Manson comes up as one. I know that's a lot of shocker for a lot of people. People are like, "Whoa, hold on, Pete. Wait a minute." I'm like, "Listen, hold on, guys. You're sleeping here." So, but anyways, the next question I ask everybody, and the important question of the day is that if you could break the stigma about mental health. Now, when I ask you this question, it
Mhm.
could be the number one thing that you see all the time that just drives you absolutely crazy. What would you say that would be?
I would say that it's people being held accountable for symptoms outside of their control. So, like, if we know that somebody has ADHD, let's say, and I just would encourage folks to start seeing it more from a medical perspective. So it's like you wouldn't, if somebody's got a broken arm, you wouldn't, say you should play tennis or something like that. And so
I love it, man. I love it.
yeah, it's the same thing, and so I would just encourage people to see it as a medical thing and not necessarily within the direct control of the person. That said, we can, everybody should be accountable on some level, but I think we've got to give those folks some grace.
I agree, man. I agree 100%. Brian, thank you so much for coming and hanging out with me today, man. I absolutely enjoyed this interview. It was a great time meeting you. I'm so happy that we have people like yourself that are doing what you're doing these days, man. And keep me updated though, man. When you make it to Texas, you never know. We might have some people that have been on the show. You can add to your network of people that do things in that area too, man.
Yeah.
I love it, man. I love what you're doing though. So do you want to go ahead and plug where everybody can find you? What's the best way to reach Brian if they wanted to?
All right. So, company website is www.empowermytherapy.com. Then, if you go through that, you just click contact or, book a session. I do 20-minute consultations for free. You can do that. And so I can tell you what the services we have. And the other good news is that Texas is coming soon.
That's right, baby. He's coming to Tejas with the rest of us. So that'd be awesome,
Yeah.
man. Definitely. Definitely. Brian, do you have any socials or anything that you guys use like that? Instagram, TikTok, all that kind of great stuff?
Yeah, we're on Instagram, Facebook, LinkedIn,
What's your handle?
just Empower Psychotherapy, LL.
Brian's like, damn, you're putting me on the spot here, man. Hold on a second. Let me
Yeah,
think.
it's like, let me
You're
look
good,
that
man.
up.
Listen,
Yeah.
man. Brian, once again, thanks so much for being here, man. I had an absolute fantastic time, man. And when you make it a text, like I said, let me know. I'll definitely be following you on Instagram so we can share it out with when we get ready to post this episode and stuff too, with little clips and things like that. And that way
Mhm.
people can come check out your services and stuff like that. And when you hit Texas, obviously we're gonna have to make an announcement so people know
Of course.
they can now use your services here as well. I do
Mhm.
have a couple people I know that are neurodivergent that could probably benefit, that might
No
want to
problem.
check your stuff out as well. So I'll definitely have them check it out and things like that too. But with that being said, guys, we're going to wrap up this episode of Pete vs. Anxiety. You guys are going to find me on Pete vs. Anxiety. I'm an X all the way down to TikTok. I'm on Spotify all the way down to Pandora Radio. And as I always say, it costs nothing, absolutely nothing to be kind to somebody. One kind act you can do can save someone's life, or hell, you can make their day. I'm Pete vs. Anxiety signing off saying, don't ask how your day is today. Say, hey, how's your mental health today?